Alright, I'm going to show you how to position a patient for an OPG. So, alright, first of all, you can see here has open and close. The open and close opens and closes these little head supports. This mouthpiece you can just pull up and down with your hands. If you pull it up, it'll just slide down by itself. Then here is where you turn the beam, the light, kind of laser light on and off. And here is where you control the height and of the machine and also of the beam. So we've got it a bit tall for Anita, so I'm going to get Anita to step in, hold on to, so the patient needs to hold on to the, is it okay I said your name in the video? They need to hold the handlebars, and now we can see how tall she is. So we're going to try to line up this mouthpiece with her mouth. Okay, now you have to say, Anita, can I just get you to bite in the little groove in the slot here in between the two bumps, just with your front teeth. So show your teeth. So see how she's just got her front teeth in the little slot in between the two bumps, and her chin is resting on the platform, which is where we want it. Now you can close your lip, actually open, yeah, that's, so try to make sure that this line in the middle is lined up with the patient's nose and their teeth. If it's not, then you might have to get them to shift left or right like that. Yep, thanks. And then now we need, oh, I'm blocking the beam. Okay, I'm gonna try to do this in a way that I'm not gonna, because when I put my hand here, I think it comes out of that. Okay, so we need to line it up, the alar of the nose and the tragus of the ear. It's already in the right position because we want it at the top of the alar and the middle of the tragus. So if it's, so the alar is just the little corner of your nose, and the tragus is that bumpy part that goes into the middle of your ear. So you want it to draw a line between the top corner of the nose here and the middle of that little middle flap of skin on the ear. Okay, all right, now you need to close the head support. So over here you're going to press close, then you can turn the beam off. Now you need to say, Anita, can you please close your lips together and press your tongue to the roof of your mouth? And I think she's okay, but sometimes they need to take a few steps forward because, yep, because sometimes their feet are all the way back. Usually if they need a step forward, it would be before we position their head and everything like that. I probably should have done that first. And then you just need to push ready. If you needed to move the beam up and down, I'm just going to turn it on again so I can show you. These side arrows move the beam, which is the line on the face. So if you need to move, if you need to move it up and down, so okay. All right, now I'm going to turn the beam off and you press ready. See how I pressed ready and it's still red? That means that, oh, maybe you just have to wait. I always thought it meant I hadn't pressed it properly and I will keep pressing it. Maybe I'm just impatient. Okay, and then the machine will get ready. Okay, and then that is how you position the patient for the OPG. There's a separate video that tells you what buttons to push and everything like that. Okay.